All right. Up, up, down, down, left, right, BA, select, start. That was the cheat code that we used to get 30 extra players on the video game Contra in like the 80s or 90s. That is a cheat code. And if anything I've learned over the last 20 years of doing developmental behavioral pediatrics is that people caring for children with an autism spectrum disorder are looking for cheat codes. And today we're talking about leucovorin and autism. What do we know about it? How does it fit together? And why is it important? Here is what you can think about as our dip map for today. Listen, if you're not sure this video is for you, give me 30 more seconds, okay? We're going to talk about leucovorin. We're going to talk about leucovorin and autism. We're going to talk about the benefits of this medication. We're going to talk about side effects. We're going to talk about cost, okay? And we're going to talk about the application, like why are we thinking about this medication as it relates to autism? Why are some people calling this a cheat code for autism? Well, let's first start with a better question. Why are we talking about cheat codes in general? Well, listen, 1 out of 36 kids have autism, okay? That's a lot of kids. 4 to 1 male to female predominance. There's environmental factors. There's genetic factors. There's all these things that are playing into this condition. And when you're overwhelmed by the needs of these families, by the neurodevelopmental hurdles of these patients, people start looking for cheat codes. And there, over the course of my career, have been several. Let's talk about a few brief ones. Let's talk about hyperbaric oxygen. Listen, this was a cheat code that people talked about for a long time, and they're still talking about it, but it's not something we recommend because it doesn't actually deliver on its promises. The only thing this is good for is getting in and going to the bottom of the ocean as a submersible vessel. Okay. Children with autism aren't going to respond well to being put into a giant metal lung. Okay. How about this one? Chelation therapy is another potential cheat code that people have been looking for, right? You're going into a place and they got a lab and they're doing some IVs and they're running stuff and they're chelating things we don't really know. And we're looking for outcomes. We're looking for cheat codes. We're looking for that breakthrough intervention as it relates to autism. Gluten, casein-free diets. These are cheat codes that people have looked for. Homeopathic remedies like essential oils or maybe good old camel's milk to try and address, the redox reactions in the body's need for these types of things to occur. The idea of cheat codes as it relates to autism, the idea of new and novel interventions that are going to provide a breakthrough for children that are up against these neurodevelopmental hurdles, this is not new. This is not new. And certainly when we think about leucovorin, it fits into a long line of potential breakthroughs. But what I want to submit to you during our time today is that leucovorin is different than all the things that I've just discussed, because leucovorin is accessible, it's reasonable, it's safe, and it has some nice data to support its use. So I want to talk about leucovorin and autism with you today. But why is this so pertinent right now? Leucovorin is not a new issue. It's been around. It's been around in circles in regards to autism for a while. But recently, for those of you who are aware, CBS just did a feature on a family. This was last week. Okay, this was last week. This would have been a week ago in February, where they did a feature about a family who had a child with an autism spectrum disorder who was significantly delayed in his ability to communicate using his words. And so the family sought out research and were led to an intervention that involved the medication leucovorin. And when they started leucovorin in their child very quickly began to demonstrate extravagant progress in his ability to express himself verbally. And since that feature has come out last week, my office, the office I work in, the team that I work with, has got no less than 1,000 phone calls about this. Okay. That's hyperbole, but it's true. So we thought, what's the best thing we could do? Let's gather together the information and let me teach you exactly what you need to know about leucovorin, because I do feel it is a different intervention than the things that we've previously discussed. It's a lot closer to a cheat code than the other things that we've been thinking about. So let's talk about leucovorin. All right, before we talk about leucovorin, listen, we got to talk about some serious chemistry stuff, okay? We got to understand how folate works, because the story with leucovorin starts with folate. Folate comes to us in our foods. It comes to us in our foods. We eat some broccoli, we eat some multivitamin, we do the things that people who love folate do, and it gets into our body and it goes through this complicated system of arrows, okay? And it becomes other things, tetrahydrofolate, 5,10, methylene, tetrahydrofolate, and it goes around this circle, all right? These yellow boxes are different enzymatic reaction or enzymes that take one thing and make it into something else. And folate metabolism, okay, it looks pretty simple when you look at it, but it sits in the middle of like a million different processes in the body. Folate is super important, right? It's more than good old vitamin B9, right? Folate is important, and it's important because it doesn't just go around in circles. It's important because of what spins off of these circles and what those products, that downstream revenue of folate, do. What's their purpose? What's their point? What's their function? Let's talk about it. So, as you can see on the right side of our screen here, folate metabolism skews off and feeds different processes in the body, one of which is redox reactions. So like the cleaning up of the body, the cleaning up of different products, methylation, which is kind of providing fuel for enzymatic reactions. But the thing that I really want to focus on today, okay, is the DNA and RNA synthesis in that bottom right corner. You can see it in that bottom right corner. Folate is a part of a system that feeds the production of DNA and RNA. It also is part of the synthesis of neurotransmitters, and it's fuel for mitochondria. Listen, I've said it 100 times. Folate is super important, okay? But we still haven't figured out, well, what does that have to do with autism? Okay, we're getting there. Just hold on. So, in order to understand how leucovorin fits in, you have to understand what it's initially used for. Like, what does leucovorin exist to do right now? Because if you want to explore this intervention for you or a family member, and you want to partner with your healthcare provider, you need to be able to work together synergistically, and you need to be able to speak the same language. You need to be able to speak the same language, right? You can't use when you, I feel statements in order to justify a prescription sent to a pharmacy, right? We have to speak the same language, and this is the language of your provider. It's right in front of us. When we hear leucovorin, we think methotrexate. Methotrexate is a medicine that is used as an immunosuppressant, okay, so it can calm down the immune system, often used in autoimmune conditions like juvenile rheumatoid arthritis, okay? But it's also used in cancer treatments. So osteosarcoma, as an example. Individuals being treated for these conditions would receive methotrexate. So when you bring this up, when you Google leucovorin, when you talk to your provider, you talk to your family, if they know anything about medicine, they're thinking, well, does this kid have cancer or would rheumatoid arthritis? No. We think about methotrexate, and methotrexate works like this. Methotrexate blocks, okay, the circle, this wheel of folate metabolism. And the reason that it does that is because methotrexate needs to stop the rapid production of cancer cells. What do cancer cells need in order to produce more cancer cells? Well, they need DNA and they need RNA, right? They need logs on the fire, right? If we have a campfire because we're best friends, I'm in your backyard, we can only burn that fire for so long before it burns out. We need more firewood. And methotrexate comes along and says, guess what, cancer rascals? You guys don't get any more firewood. You're about to go cold. So methotrexate is used and it shuts down this folate metabolism, but there's a problem. The problem is that folate, it feeds not only the bad cancer cells, right, to help them with the RNA and DNA synthesis, but it also feeds the good cells, the cells that are not naughty, okay? And then when you shut down both the good and the bad, you start to get all these consequences and all these issues that need to be addressed. And this is when we begin to think about leucovorin as it relates to leucovorin rescue. Look at this. So we give leucovorin, okay, to rescue individuals from, right, methotrexate treatments. Now, that doesn't mean that when you give leucovorin that you rescue the cancer cells. No. Once they've been punched in the face by methotrexate, they kind of stay down, right? You punch them and they kind of stay on the floor. But then there's all these other cells that still need, right? They still need to receive folate in order to repair themselves and divide and be healthy and help the body grow and repair. But so methotrexate's gotten in the way of that. But then we start sneaking in leucovorin, right, on the other side of this folate metabolism. And leucovorin is, through some magic science, is transformed into 5,10 methylene tetrahydrofolate, which you can see on the left side of our screen. And then that starts to funnel through the folate pathways, right? And it goes on and it feeds the good cells with a new supply of folate so that they can continue the good work of making DNA and RNA, all while methotrexate holds the bad cells on the floor in a chokehold. That is how the healthcare community has come to understand leucovorin until recently. Okay, so let's talk about what we're talking about now. Let's talk about leucovorin and autism, right? Because I've just given you some good science and some good understandings, a baseline understanding of what leucovorin is and how it fits in, but we still haven't explained how do you make the jump from leucovorin as we know it to leucovorin and autism on CBS. Well, let's talk about it. We are going to, here's our slide again, okay? But here's what we're going to focus on now. I want to focus on this bottom part. Okay, because the folate metabolic pathway is feeding the body with folate, with forms of folate that it can use, which we'll call reduced forms of folate. That's what this circle thing does. It reduces the folate and makes it usable by the body. And in order for folate to be used by the brain, it needs to be transformed into 5-methyl tetrahydrofolate at the bottom. You see it there. That's what we're going to call brain candy. Okay. The brain's over there, and the brain's like, hey, I need some methyl tetrahydrofolate so that I can do what I need to do, right? Because we got to get it in there. So you got to get the brain candy into the brain, and that's where autism and leucovorin, that's when our story heats up. So here, let's look at this. Okay, so on the left, you see this cylinder. It's a pink cylinder. It's not red. It's pink. It's meant to show that that's the blood, that's the serum, that's the body side of it. Okay, that's the bloodstream. And in the bloodstream, because we have a functioning folate metabolic pathway, we've got some 5-MTHF, which is 5-methyl tetrahydrofolate. That's the brain candy. Remember that, it's the brain candy. Now we've got to get the brain candy from the blood where it's been produced and it's doing all of its good stuff. We got to get it into the brain. Okay, because the brain needs its share of folate too, right? But the only way you're getting it into the brain is by using folate receptor alpha. Think about folate receptor alpha like bouncers, okay? You want to get into a bar, hey, I want to get in there and do all the dancing with all the cool people. And you meet a bouncer, and the bouncer looks at the list and says, nope, Noble, you got a pointy nose and it's crooked and you got gray hair. You're not coming in here, brother. Nope. And I say, but come on, man, this is ridiculous. And they say, sorry, no way, right? The folate receptor alpha is the one, it's the bouncer. It lets the things that need to be inside the brain. And the blood-brain barrier is that kind of restriction that does not allow just anything to cross the blood-brain barrier. But if the bouncer, okay, so back to our metaphor, if the bouncer, which in this case is folate receptor alpha, if he looks on the list and says, yep, 5-methyl tetrahydrofolate, brain candy, check, you're on the list, get into that party and have a great time, right? You're good. That's how the good brain candy folate gets into the good brain, right? And the brain needs this, just like everything else needs, right? The brain needs DNA and RNA, and it needs to make neurotransmitters. It needs to do all the stuff that folate and brain stuff do, right? So what happens when folate can't get into the brain? Well, let me tell you, something bad happens, okay? There's a condition over the last 20 years that's been described, and it's called cerebral folate deficiency. And here's what it looks like. You have a normal amount of brain candy, which is 5-methyl tetrahydrofolate, okay? It's on the pink side, it's on the cylinder side, and you have a normal amount in the serum, which tells you, hey, the folate metabolism pathway is working, all right? So there is enough folate to go around. But the brain's over here, and we look at CSF, which is cerebrospinal fluid, and we sample that, and we say, well, yeah, but folate's normal in the blood, but it's super low in the brain. Like, what gives? The brain needs this, right? And when the brain can't get access to the brain candy it needs, you develop a condition called cerebral folate deficiency. Now, this is a very rare condition, and it's very, very bad. Okay, this is a bad thing, all right? And what they've realized is that individuals who have this condition have a few things that you might recognize. Language regression, delay in speech, cognitive delay, regression, ataxia, some other neurologic issues. A lot of different systems become affected, and individuals begin to regress in their developmental skill sets. They lose their language, they lose all these things. Now, as you know, that sounds an awful lot in some ways like individuals who have been diagnosed with autism. So people start to ask some questions. They say, now, wait a second. Some of these individuals with cerebral folate deficiency actually were diagnosed in addition to that condition with autism. So it raised another set of questions. Could it be possible that folate has something to do with autism. And so in order to understand that question, they had to say, well, what causes cerebral folate deficiency to begin with? Well, here's what you got to know. 3 things, my friends. 3 things. The first of which is there's a mitochondrial problem. Okay. Now, mitochondria are like a gas can. See this gas can here? They're like a gas can. They provide the fuel, all right, for a number of different actions within the body. They provide the fuel to get the folate from the blood into the brain, right? That's a transport mechanism that requires fuel, power that that mitochondria provide. And there are genetic conditions like Kearns-Sayre syndrome is an example that affects mitochondria and eliminates the body's ability to transport folate into the brain, and it causes a bunch of problems. There's another condition. In the middle here, you see a strip of DNA. Now, there are specific conditions that involve gene changes in a gene called FOLR1. FOLR1. Now, those are very, very rare. Okay, mitochondrial issues are very, very rare. FOLR1 conditions are also very rare, and that is a specific condition that creates a change in the structure of those transporters of the folate receptor alpha, okay? It changes the structure of folate receptor alpha, and it inhibits its ability to do its job. So think about bouncers that aren't doing their job. They're just like taking the day off, or they don't really know who's supposed to come in and who come out, so they just don't do anything. That's what it's kind of like. And then the last of the 3 common causes of cerebral folate deficiency are autoantibodies, and that's where we're going to spend the majority of the rest of our time. Now, look at that guy. You see that guy right there? He's got no sleeves. He's got some tattoos. He's got glorious facial hair. You don't want to mess with that guy. That guy, my friends, is an autoantibody, and we're going to talk about him. Now, when you think about individuals with autism, okay, this is where the story gets even more interesting, because individuals with autism have in terms of etiology or underlying cause, they have all of those things that we've just listed off have been implicated in as possible contributing factors to individuals with an autism spectrum disorder. So mitochondrial conditions, individuals with autism, up to 30 to 50% of individuals with autism have been noted to have abnormalities in some of the processes involving mitochondria. That doesn't mean they have a mitochondrial disorder. It just means that somewhere in the pathway, the metabolic pathway that involves mitochondria, there's abnormalities that have been detected that have raised concern that maybe mitochondria is a part of it. That's up to 50% of kids with an autism spectrum disorder. Now, how about the number of kids with an autism diagnosis who have a single gene disorder or have an underlying genetic change that has resulted in autism as a diagnosis? And as you can see on the middle slide, that's 10 to 20%. That's 10 to 20% of kids who come to my clinic. I'm a developmental pediatrician and a clinical geneticist. And when we do the testing on kids, up to 20%, sometimes higher, I would argue higher, you find a condition that has resulted in an autism spectrum disorder due to the genetic change. And then lastly, individuals with autism, based on current research, up to 76% of these individuals, when you test them, have found to be positive for autoantibodies. Up to 76% based on current research have been shown to carry autoantibodies to these receptors, inhibiting likely the ability to transport folate from the blood to the brain. Now, I gotta tell you something else. Just because a child has an autoantibody, just because you do a test and you figure this out, we'll talk a little bit about the testing in a little bit. Just because you have that, it doesn't mean that your child has cerebral folate deficiency. As I've said, it's a very rare condition, and the way that you diagnose it is you have to prove that the child has diminished or negligent amounts of folate in the brain by doing a spinal tap. And I will tell you, there's not a lot of people lining up to say, where I got to go to get me some spinal tap. Probably not, right? So it's not a condition that's going to be diagnosed frequently, and there's not a lot of cases in the world. So please don't jump to conclusions that your child has that. All I'm trying to do is draw the arc between decreased folate in the brain and its implications as it relates to autism, and then follow that feedback loop around to how leucovorin fits in. So back to the blood-brain barrier. We got 5-methyl tetrahydrofolate, the brain candy folate, that's in the blood. We want to get it to the brain, right? And we need these folate receptor alphas to do their job. But now we've got these autoantibodies. Now these rascals, they're mad, they're frustrated, okay? They've had better days, and they're not here to mess around. They want to fight. They're not going to let that folate, that brain candy pass through. Thou shall not pass they say. And the brain is over there trying to get what it needs, and it's not happening. No RNA, no DNA synthesis. You're not getting neurotransmitters. You're not doing the stuff that you need to do. Your mitochondria aren't getting fed. Bad things are happening in the brain, right? It becomes clinically significant. So, but here's the great news. Here's the great news, okay? So, like, there's always more than one way to get into a place. Like we're using the bar metaphor here, so we'll just finish it out. Let's say you try to get in the front door and you know what? The bouncers aren't doing their job. They don't have a list. They're not letting anybody in. They're not really doing what they're supposed to be doing. But you know that because there's fire codes, there's a back door to this place. So you, because you're smart people and you really want to go in and listen to some music, you're going to sneak around to the back door. The body has the same kind of mechanism. Okay, folate receptor alphas are shut down by these autoantibodies. They're shutting them down like, no way, we're not coming through here. Forget that. Candy's for me, not for the brain. Ha ha. But there's a back door here, and that back door is called a reduced folate carrier, RFC. There's a back door. There's a back door. The body has mechanisms and contingency plans and contingencies upon contingencies. So if one system doesn't work, it's going to boot it to the next system because the body is programmed to survive. So folate needs to get into the body. The primary mechanism or front door is shut down, but there's another way. The reduced folate carrier is the back door. Now, it's not a big door. It's not wide. It's not meant to take a lot of people through it, right? It's not easy. It doesn't have a high affinity for people coming into the nightclub. It does not, but it can let them in. So what do? We take leucovorin, all right, which by scientific magic is quickly reduced, okay, into or oxidized into a form that is 5-methyltetrahydrofolate, which is also called brain candy. Okay, and it quickly is changed into brain candy, and then we take that brain candy once it's broken down and do it the piece that can actually be transmitted into the brain, and we sneak it through the back door. And leucovorin makes that back door a very crowded place. Right? So it's still slower than the front door, but leucovorin continues to push brain candy through the back door more. And that reduced folate carrier starts to have to let more and more people in. And at some point, the brain gets enough folate for it to begin to heal itself and get its necessary processes back online. That's what I'm talking about. And then you get some methyl tetrahydrofolate or brain candy in the brain, and you can see discernible benefits from getting the therapeutic amount of folate into the brain. Now, I want to reiterate this because we're moving through this, and I want to get this right for you. Just because you have an autoantibody, you got a mean guy over here in blue with no sleeves, that does not mean you have a diagnosis of cerebral folate deficiency. They don't mean the same thing, so please don't jump to conclusions and understand me. What this does mean is that if you do have autoantibodies and the front door of the bar is closed, you might be able to take some leucovorin and sneak around to the back of the bar and slide some of that in there and see if there's any therapeutic benefit as it relates to speech and language, social and emotional delays, and other core features of autism that could potentially improve. Do you see now how this link works? Now, just because you have autoantibodies, right, doesn't necessarily, or you're concerned that your child may have autoantibodies. You're listening to this and you're thinking, that's it, I got to go and get the autoantibody test because there's no way I could possibly do this without knowing if my child has tested positive for the autoantibodies. And what I want you to understand is those tests are available. Absolutely, they're available. And they're blood tests, and it's probably going to cost you $200, $300, $400 probably to get those run. Your insurance is unlikely to pay for that, and these are going to be. There's not going to be a small expense, and you're going to get them back, and they're going to say you got autoantibodies or you don't, or you got a lot of them or you got a little of them. I don't want you to think that getting autoantibody testing is absolutely necessary in order to consider leucovorin for your child, because I would suggest to you that at this point, knowing whether or not somebody has autoantibodies or to what level they have autoantibodies probably doesn't change my care plan. I'm probably still going to do what I'm going to do because of things I'm going to tell you next. Now let's talk about benefits, side effects, and costs, right? Let's talk about it. Let's get serious about this. Let's talk about the benefits first, right? If we're going to do this, right? If you're going to go to your doctor and you're going to get a prescription for a pill, right? That's not on formulary, okay? It's not FDA approved. It's off-label use. You're going to pay cash for this. 100%, right? And if you're going to do that, you better be sure that you know that there's a likelihood that this could work. And we've just done the legwork over the last 20 minutes of helping you understand that, yes, this could work. And even the better part about it is you know why. You actually know why this could work. So this is the beautiful part about this. So let's talk about it. So there are several benefits that have been delineated in some of the highest levels of research. And again, that doesn't mean that there's thousands of studies. Okay, it does not mean that. But it does mean that there's systematic reviews and meta-analyses and double-blind placebo-controlled trials and blah, 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 blahs and all the things. Now, there's not thousands of, but there are enough for me to say, you know what, there's some real benefit here. So here's some of the benefits they saw in these studies. They saw core features of autism decrease. Okay. Now, that's a big statement. I could talk a lot about that. What do you mean by core features and blah, blah, blah. But suffice to say that as we define autism spectrum disorders, the core features of the problematic issues within that diagnosis were improved to some extent in a statistically significant manner. Next up, verbal communication skills improved. That's the story from CBS. That's the story from last week. Now, maybe that kid would have done great irregardless. I don't know. The parents, I'm sure, are doing an awesome job, awesome therapy groups. Everybody's working hard. But there are some data, again, at the highest levels of research to demonstrate that kids who receive leucovorin over a 10-week trial period, some of them longer than that, at ages as young as 3, the studies have shown that even as young as 3 years of age, and I think, and beyond, of course, those kids have been shown to have some discernible benefit in their verbal communication after taking leucovorin. Stereotypic behaviors. So stereotypical behaviors, hand flapping, head banging, spinning, rocking. These aren't things that need to be changed in people. Nobody's trying to change anybody, but sometimes those can be disruptive things, not necessarily for everybody else, but sometimes for the child's ability to learn and grow and build on learn skills. And then lastly, hyperactivity and non-compliance was shown to improve in a statistically significant manner secondary to a trial treatment of leucovorin. What are the side effects? Listen, anytime you make a medication in a lab, people are in the lab and they're working under fluorescent lights and they go to like a vending machine on their break and they have like a hairnet, but they have to wear it over their beard. They wear white coats. When you do stuff like that and you work in labs, that's going to have some side effects. Okay. You make medicines that you're going to have side effects, but it's important also to be reminded that medications can be really helpful, but medications are not the only answer. If you're watching this and you're new to the channel, I'm not trying to tell you that this is the only way to do stuff. There's a lot of ways to do stuff. I don't want a medicine for your kid. Nobody does. Doctors don't drive around in white vans throwing medications in kids' mouths, right? We're not just like, hey, pull over. I see a kid over there with nothing in no pharmaceuticals in their mouths. Like, doctors don't say that. I don't want that, right? But when you take a medicine from a factory, you're going to have some side effects, okay? Because medicines that are effective or medicines that have effects have side effects. So let's talk about it. In the studies that we have available to us, there's been 5 primary side effects that have been shown to be consistent across studies. 10% of kids have some level of aggression. The important thing to remember there is that a lot of these kids were aggressive at baseline. Not all of them, and I'm not trying to generalize, but it's possible, right? Excitement, agitation, just over 10%, headaches, insomnia, increased tantrums. But, these are all things that nobody wants. Like, that's why we take these medicines. That's why we do these interventions. That's why we go through the steps of accessing the services so we can, get away from those things. But at the end of the day, you have maybe around 10% at most of these kids are going to experience one of these common side effects. But what's the flip side? Well, 90% of them don't, right? So that's good. We'll take that. And when I think about side effects of medications that are FDA approved, that are prescribed by my clinic, by myself on a daily basis, those side effects can include increased weight gain, increased risk of diabetes, prolactinemia, galactorrhea, which is your breast by development producing breast milk. Like it's just, these are things that you can see in kids, fine motor tremor, akathisia. Like we prescribe medicines currently in the treatment of the difficulties that individuals face with an autism diagnosis that have far, far worse side effects. So I don't think this list of side effects is that big of a deal. Okay. But there's side effects, and you're smart people and you deserve to know all the stuff. Now, let's talk about the cost. As I said, you go to the pharmacy and you're like, I'd like some I'd like some Leucovorin, please. Right? And let's say you get a script from your doc or your provider or whatever. If I'm in that pharmacy, I'm thinking Leucovorin sounds to me like something from Star Wars. Like a Sith Lord, or like somebody who's going to fight, and dressed in black and has a scary face. Like, that's what I think about. But they're going to hear you say Leucovorin, and they're going to look at the script. They're going to see what the order's linked to, and they're going to say, well, this is not going to be a covered expense for you. You're going to have to pay out of pocket because this is off label. And the best I can understand is this is about $35. Why is that important? Well, listen, $35 is not $0, right? It means your insurance company's not doing anything to help you. It means you're going to feel the sting, and I get that, right? $35 is a kick in the face for a lot of people, and I recognize that. But it could be $3,000, could be $300, right? You think about off-label use where you're paying out of pocket for medications. I think much higher numbers. And the reason that it's low is because Leucovorin's not new. Leucovorin's old. It's an old medicine, like the 50s. I think it was developed in the 50s. And so we know a ton about this medication, so much more about this medication than we know about camel's milk, right? You have to watch the beginning of this video to know what I'm talking about. Okay, now let's talk about application. I'm going to now bring it all together. I'm going to land the plane and give you the most valuable parts of this video because you deserve to know how this applies to your life. But listen, can I just ask you one thing? If there's any value from this at all, put your questions in the chat. If you've got them, put them in the chat. Oh my goodness. Here's an example of a chat. Does Leucovorin require a prescription? Dennis is asking. Yes, it does. Yes, it does. Now, and that's according to me. Like, I know it's on formulary a lot of places. I know that if I type it into my electronic medical record, Leucovorin will pop up, and I can choose which pharmacy to send it to. So I'm going to go with a yes, sir, on that one. Okay, but there may be ways that you can access that outside of that, because I know there's people who do that with some things like antibiotics. Sometimes I don't know how that works, but to my knowledge, yes, this is going to have to be in a partnership with your primary provider. So put your chats in here, put your questions on the upload on YouTube, and I will see it. And then lastly, if there's any discernible value, please like and subscribe, because otherwise we really can't get this to a lot of people. The algorithm, it really doesn't work. Okay, so let's keep going with application. Here's my disclaimer, friends, because you're my best friends, you're my best internet friends, and I'm a developmental behavioral pediatrician and geneticist. I got to tell you, I am that, but I'm not yours. Okay, I wish I was. I wish I could see every one of you and give you a high five and a hug and tell you you're doing awesome, because I know that you are. I know it. But I'm a doctor, but I'm not your doctor. Okay, so we're going to talk about Leucovorin. We're going to talk about dosing. We're going to talk about some ways that you can talk about this as your primary care provider. Okay, and ways you can advocate for what I would suggest to you is a lowbrow, simple, safe intervention that is worth a try. Okay? And I'm going to talk to you about it, but I need to give you that disclaimer that I'm not your doctor. You got to talk to your own provider in order to make these decisions. Now, that's my disclaimer. A couple more things. When we think about how this applies to our life, the first question I have for you is, should it apply? Right? Should this apply? When I was a kid, I grew up 7 miles west of nowhere in Iowa, and it was a great town. It was a gravel road. And my dad would take me into the grocery store. It was called Buy Right Food Centers. It was a great store. And at checkout, they always had periodicals. And one of the periodicals they always sold was the National Enquirer. And on the front of the National Enquirer was always Bat Boy. And I don't know how Bat Boy's doing these days, but he was a boy then when I was a boy, so he's probably about 50 years old. Hopefully he's doing well. He was half boy, half bat. Okay, that was the National Enquirer. That is a periodical. It is a piece of paper with words typed on it, and it says things about stuff, right? Just because people write things down on paper doesn't mean you should pay attention to it. Just because you see a YouTube video or you listen to a story on CBS about Leucovorin doesn't mean that you should go and do that thing, right? But as I've told you up to this point in time, there is a lot of evidence and a lot of just kind of biochemistry that suggests that maybe you should try it. Okay. But you still need to ask yourself, what's the level of data to support this? And here's what I want you to know. It's the top. It's the top. It's the top level. This is the evidence-based criteria pyramid. When you think about the National Enquirer and the Bat Boy, it's not even on here. It's like the bottom of the bottom. It's like underneath my name. It's down there somewhere, right? But then when you look at the highest level of data to support things, you've got systematic reviews, meta-analyses, randomized controlled trials. The studies on Leucovorin as it relates to autism, as it relates to folate transport, as it relates to all these things have evidence to support its use in autism at the highest levels. But that doesn't mean that there's not more room for more studies, because there's not a ton of those studies. There's enough to say, this feels like it could be okay. Like this might be worth a try, but there's not like, hundreds of them, or we're not there yet, but I think we will be soon. So should you listen to it based on the evidence? Should you think about how this applies? The answer is absolutely yes. And then the other question before I get to the dosing, the nitty gritty stuff, is a better set of questions that you need to think through and that your provider is definitely thinking through, is the question of, is this intervention sexy? Is it sexy? Is it safe? Is it safe? Is it safe? Like, so you think about chelation therapy, or you think about, like infusing stem cells into people's cerebral spinal fluid in Peru. I'm going to go with, that doesn't feel safe to me. That's a thumbs down. That's 0 stars out of 5. Okay. That's not safe. That's not a good idea. It's super expensive, right? Hyperbaric oxygen could be several thousands of dollars. And I mean, there just things can happen that can really be terrible in those things, right? So is it safe? Your doctor's thinking this through. Your primary provider's thinking this through. Is leucovorin safe? Well, I've just told you, right? Look up the side effects. There's side effects for every medicine made in every laboratory, but they're pretty minimal in the grand scheme of things. And then look up like the side effects of Risperdal or Ritalin or Abilify or any of these other medicines that we use every day in the treatment of autism. And you'll be like, wow, leucovorin, I'm going to take me some leucovorin. Is it easy? Is it easy, right? So you have to talk to your provider and you have to say, look, there's some new data to support the use of leucovorin, some of the highest levels of support. There's a CBS article on it. Leucovorin side effect profile is pretty simple. Leucovorin's cheap. It's easy to access. Can you just send a script to the pharmacy, or would you be willing to look at the data and get back to me, right? Is it cheap? Yes. Cheap, air quote cheap. You'll have to pay for it, but you're not bleeding. I mean, you're not bleeding egregious amounts of money, but I want to be sensitive. $35 is $35, right? But you're not bleeding tens of thousands of dollars, right? You go to do hyperbaric, like good luck. It's going to be like 10 sessions that they're going to be super expensive, and it's not going to work. Okay. And then lastly, is it sensible? Like, does this make sense? Does this make sense to you? If it does, and again, like that's why this is so easy for me to do this and read all these articles and put all these blah, blah, blahs together, because the more I got into this, the more it just makes sense. There's a lot of things that don't make sense, right? People say like, well, it's actually quite simple because there's a leaky this, and then the pores get big, and then the thing happens, and then you got to do this, and then you got to take this multivitamin, but then you got to follow a chaser with a banana. And it's like, I'm sure that there's some science in there somewhere, friend, but it also feels like you're just saying words about guts and brains, and you got to be more specific. I'm not saying it's not true. I'm just saying you got to be more specific, okay? And that's what I'm trying to do. This is how you have a conversation. This is how you become synergistic with the healthcare communities. You got to learn to talk the same things, because we don't want to hurt you, and we don't want you to waste money, and we want you to do things that are sensible. So now here's the dosing. So you go to your doctor and you say, look, or your provider, and you say, look, here's the articles, okay? And it won't take you very long to Google, leucovorin, autism, articles. And you'll find a good chunk of them, okay? And Dr. Fry, I think it's Frye, he's out of Arizona. He's done a lot of the seminal work on this, him and his colleagues. So if you just Google that name with that, you'll find some of the best articles. He's done a great job. It's awesome. So you can hand them those articles. You can bring them the citations. You can find the citations for free on PubMed. You can't read the articles, but you can get the citations. You bring those in, give them to your doctor, and say, listen, I'm going to summarize this for you, okay? The dosing for almost all of these studies is between 2 points. It's between 0.5 and 2 milligrams per kilogram per day. Don't ask me why we do that to you. I don't know. I don't know what happened. We just do that to people in medicine. We have to make it complicated and all this stuff. But there's a range of dosing, okay? A conservative end of the dosing is 0.5 milligrams per kilogram per day. An aggressive range is going to be up to 2 milligrams per kilogram per day. But, do not just do the math blindly. Well, I'm just going to do the math. I'm going to do a bunch of the math. And 2 milligrams per kilogram per day, and my kid's, 80 kilograms, that's 160 milligrams. We're going to do that. Nope, I did not say that. You stop at 50. And maybe there's room for more, because when you think about cancer treatment, you think about immunosuppression for autoimmune conditions. Yeah, the dosing profile is probably higher, right? This is still pretty conservative as it relates to leucovorin, right? But what we know from the data is that people in these studies that I'm talking to you about, this is the dosing range they use, okay? So this is where we stay until somebody tells us different. We know it's been safe, we know it's been effective. So this is the cheat code, right? This is the up, up, down, down, left, right, BA, select, start. That's what this is for your provider. So now, another question for you. So you've heard this, right? I've kind of laid it all out for you, and I'm here thinking, what else is there for me to do? Like, what else do I need to be thinking about? Well, listen, I would very much like to go further with you. Join our newsletter, for crying out loud. It's easy. It's fun. It feels good. Just click on the thing and it'll feel good, I promise. Right? Or go check out some of our other YouTube videos. I'll put a link up above with more YouTube videos. We got autism videos, we got ADHD videos, we got behavior videos, we got all the videos. Do all the videos. So go check us out. I promise you, at the very least, you'll be entertained. All right. And let me do this. I want to conclude our time together with one more thing that I want to talk to you about. And that is what I want you, specifically you, to do at the end of this video, because some of you are about to get off this video and go and make the dumbest mistakes. Okay. And I'm going to tell you what they are. You are going to get done with this video and you're going to walk away from your computer or your phone and you're going to start shoulding all over yourself. Oh, yes, you are. Should all over. I should fill in the blank. And it's always retrospective, right? Yeah, there are some things that you should do. Like you maybe get some articles, educate yourself, go back over this, share this video with 10,000 people, go talk to your primary care provider. Yes, you should. Those are things that are good things. Those are future-oriented shoulds. Those are good things. But when you look back and you make should prior tense. Well, I wish I would. I should have done this. I should have done that. Listen, all you're doing is shoulding all over yourself, and it's a huge waste of time. The only thing you're guilty of is being a good parent. So just knock it off, all right? I'm going to conduct one surgical experiment with you, and then you're done. In my clinic, as a developmental pediatrician geneticist, I only conduct one surgery with exacting precision. One. And that is the surgical removal of needless, senseless, worthless guilt, fear, and shame. Listen, there's no role in it. There's no point in it. You're a good parent. You're doing a good job. Give yourself a stinking break. Just because nobody on the cul-de-sac gets what you're going through, that doesn't mean that you're doing it wrong. It just means that they don't know how hard life can be. All right? So leave this stream, go talk to your providers, join our newsletter, and don't should on yourself because you're doing a better job than you think. I'll see you next week.